Hello, everyone. I'm Dr. Liana Lianov. I'm the founding president of the Global Positive Health Institute, and welcome to our GPHI podcast series where we interview experts from around the field of lifestyle medicine, positive psychology, and positive health. And today I'm so delighted to have with us Dr. Christina Puchalski. She's a professor of medicine at George Washington University School of Medicine and a highly published, highly renowned author in the area of spirituality, and I look forward to digging in on that topic with you. Welcome.
Thank you. It's great being here, and I look forward to our conversation.
Wonderful. So let's start from the beginning. What spurred your interest in this area of spirituality and its connection to health and well-being?
Well, I think it's a long story. I think I've always had an inkling and an interest in this. My parents were religious and even more so deeply spiritual, and my father in particular, and I explored different paths just out of interest. And the Self-Realization Fellowship Center, I think I told you about that in Southern California. That used to be a place that he and I went and just sat, as he put it, and meditated. So I've seen that a lot in my life. Also, both my parents are survivors of World War II from Poland, so their faith and spirituality, broadly defined, really is what I think gave them that hope and strength and resilience to survive. And I see that a lot in my patients, that same kind of sense of resilience. Also, I went to a wonderful high school in Los Angeles, and one of the faculty had a course on existentialism. And so we talked about existentialism from Camus' perspective, from Sartre. And it was in that class, the notion of meaning, purpose, and understanding our world. And so Terry Fleet was the professor. He just recently died, had a really huge impact on my life, as did all the faculty there, and of course my parents. But his having us question that in our lives as teenagers, I think was really important. So it's been an underlying interest. I did get very interested in research and that was my path. Even though I'd wanted to be a physician, I got interested in research and worked for a while at NIH, and remember visiting a patient who had severe rheumatologic disorder and was an artist. And I remember thinking about that as I was about to walk into the room, thinking, I've been told that this person can't move their arms very well. So I thought, I wonder how their life is. And so talking to that person, what I really learned was, and what he said, something to the effect of, yes, being an artist is what gives me meaning and purpose. And right now I can't do that, but I still have a life filled with meaning and purpose. And so, and a deep spirituality that for him was related to his art. So many different expressions. And that's been my ongoing experience as a clinician. As I moved from research to medical school, again, one of my first major clinical experiences in a hospice, where I was taking care of a patient, meeting her for the first time, asked about her spirituality and meaning and purpose. She says, I have no spirituality. I have no meaning and purpose. And then coming and seeing her a few days later, where she says, I reflected on that. In fact, my life is filled with meaning and purpose. And so our whole visit was kind of a review of her life, where those points of meaning and purpose were. So from my own experience, I always saw that as important. And I think that's what inspired me for an ethics class in medical school, where we were told the only thing you have to do for an exam is write about something that you're drawn to. So I started researching it and saw that there was work, Harold Koenig, Dave Larson, and others. I got to meet them, but I read their articles and started and talked to a person who back then it was called complementary alternative medicine, but an integrative medicine practitioner who talked about the whole person care, that being part of it. So I was inspired to write about it, proposed an elective for GW, and that course is still being taught.
Yeah, and the rest is history. Yeah, so thank you so much for that, sharing that path from the very beginning. And so you've spent many years really diving deep into this topic. Can you share a couple of highlights in terms of your professional career and how you've used this?
Yeah. Well, the elective was one, and as I saw students getting drawn to it, and even the one comment from one of my students who came to the elective and said, Holy Cross Hospital is one of the hospitals where we rotate. There's many hospitals. And this was Holy Cross, and he's Jewish. And he said he was a little anxious that it would be very, religious. And he said it was just the opposite. He said they were so sensitive, like they removed crosses off of patients' rooms that weren't identified the way. So they asked about their belief systems. Yeah. And he said he felt healing in that hospital, unlike any other hospital in the area. Mm-hmm. And so he realized that that spirituality was part of healing, was an integral part of healing. That's what he witnessed as a student. I did too. I saw that a lot, and that impacted me. I think certainly my parents' stories of how they, in their different ways, addressed or found healing in their life. I see that to this day with my patients or with colleagues or with friends. We can look at the recent pandemic. We were faced with a huge amount of uncertainty. What did that do to us? What's the next day even going to look like? And what grounds us is our inner lives. So if we address in clinical care, if I see a patient, and I do a lot of palliative care, for example, I do, as well as geriatric medicine, but if I address only physical pain, then I'm not really addressing the whole person. So I need to know how are you doing with this emotionally? Tell me what's going on with that. How are you? What's your social support? And spiritually, and what gives you meaning and purpose? Are you a spiritual person? And I see that that's such an integral part, and sometimes the main part.
Yes,
the main part of the conversations.
Yes, absolutely. And at the Global Positive Health Institute, we teach that. I give talks around this two continuum model of healthcare. So healthcare generally is focused on going from illness to health, whether it's physical or mental. But there's this other continuum that within which it's positive health, spirituality, and other components that bring us from trauma, loss, stress, loneliness, and so much more to finding the meaning, becoming our best selves. And sometimes we're just so stuck on that illness to health continuum, that we have to let that go and really focus on this other continuum that often we don't pay attention to, even in our own self-care, and let alone in healthcare broadly. So yes, I'm a real fan.
Well, and part of this whole work is, you asked what we did. So out of the elective and out of the patient experience, I then was really inspired to make this an equal domain of care, really an equal domain of care, not just lip service, but really that equal domain. And doing that, and when I started the Institute, we were fortunate to have funding from the Templeton Foundation, and they've been very generous over the years to us in partnership with us to have some startup funding. And my goal was to make spiritual health equal to the other domains, that we clinicians should definitely address it, and that we would work with chaplains. And I had just learned about healthcare chaplains a couple of years before that, and the training of healthcare chaplains, and that would be really important. And so with that, I think the key points over these last 20 some years have been developing consensus guidelines. Mm-hmm. So and I think you probably have that in your own areas, that sometimes you can do more reductionist NIH level type studies, but some of these issues are developed initially through consensus guidelines. Mm-hmm. And so Dr. Betty Farrell and I co-hosted a meeting in the United States to develop guidelines around how this generalist specialist model, clinicians addressing spirituality, working with specialists such as chaplains, works. And then we went on to do that in Geneva with a more global audience to make sure that we have a perspective that's global. And so we have guidelines for both of those. A generalist specialist model, that's how we base it on. And also we look at spiritual health, but also spiritual disease. So this is a very vibrant work right now that we're involved in, with many others, with chaplains, which is, what are those diagnoses that we as clinicians, because we do live in that world of what am I identifying here? You wouldn't just say, I think the person has chest pain, no, you'd want to know what that is. And it's the same thing with spirituality. And so this is really looking at what are potential diseases within spirituality. So loneliness. The previous Surgeon General said that was the number one healthcare problem. That's one of the spiritual distress diagnoses, or grief, or bereavement, or if you are a person of faith, some disconnection with that. Maybe I was bad, that's why this is happening, or not finding comfort from previous practices, and or hopelessness. And I think I've talked about this a lot, but it's a patient of mine, and that particular visit, many of my visits are like this, but where I knew that there was something that was there, but I had asked all of the questions in all those domains and nothing came up. And I think we use our intuition. And this is where the notion of compassionate presence, which is what I'm working on very actively now, is how do we recognize from our own inner self that there's something else with the patient? And in this case, the patient said, I'm trying to come to terms with never having hope again. I mean, that is phenomenal. And we just sat there. A lot of my colleagues, we all are trained to fix. We can't fix that, but we can accompany people. And I feel so passionate about this. I think our healthcare systems are not focused on accompaniment and partnership. So I feel very passionate about this sense of presence. I think our healthcare systems, regardless what specialty we're talking about, are not places of healing, and they should be. They should be sanctuaries in a way where people come to our office and can feel heard and not dismissed, that they can feel that they can share anything with us. And that goes to trust in the clinician, right? So the trust that they can indeed be heard, be respected, and be free to talk about things, and not where we're looking at the computer or looking at the clock, which is a reality these days, but where at this moment I'm listening to my patient, and that's the most important thing, and that's it, period. And I need to acknowledge that. And so we have a bit of a struggle in that we need to bring back that sense of the importance of healing environments, that healthcare systems should be healing environments, whether they're in a hospital, in an office, in a home visit, in wherever we are. That's part of it. And that will require our presence and our being able to practice compassionate presence. And that's something that we're working on how to train even better. We do have a program that we've developed called Reflection Rounds, where students get to experience what it's like to share in a sacred space their story of a patient encounter. No one interrupts them. They get time to share. And if someone in the room has, as the person who trained, Rosemary Doherty trained me, she says, if you're thinking of asking a question, don't say a word. But if something is coming up intuitively from you, then you might ask or make a comment, and that might help that person, perhaps if they want to go deeper. And that's the encounter that we do clinically. That's how I work with my patients. So that's a very, very, very important part of spiritual care. It's not simply doing a spiritual history. It goes down to addressing all the needs of the patient.
It comes down to, I'm hearing, that authentic, compassionate being with the patient, connecting, helping them to feel safe and to start to open up and explore deeper issues that often can be quickly glossed over as we're busy going down the checklists that often medicine tends to do.
Yeah. I mean, the checklists are important. We're there to do many things, and that's what's challenging but fun in our profession. But I think when we are attuned, and Joan Halifax has a great model called grace. So when we're attuned to the other, attuned to ourselves, and we recognize there's something here, and we sit with that true, genuine love, that compassionate presence the person can share. And then we can understand how we intuitively know when there's a closure to that sharing, and we can move back to the rest of the visit. And that is key. That is an essential part of this work in spiritual care and spirituality and health that we're doing.
So an important component that absolutely is key and complements everything else that we do in medicine, and should certainly get, like you said, equal weight, and often doesn't. So I again applaud all of the work that you do. And in lifestyle medicine, we are moving in the direction of this person-centered approach, whole health approach. And clearly this is a key part of that. And so many of our listeners are clinicians in lifestyle medicine and beyond. And if they're out there now thinking, boy, I haven't done as much in this space with my patients as I would like, what advice do you have them about some simple early steps to get started on this journey?
Well, one thing is, and they can check our website, gwish.org. We have a lot of resources, and one of them is a spiritual history tool I developed back in the 90s with my then mentor, Joan Chino, and it's changed a little bit over the times. And the goal of that is to use that as part of the social history, the person-centered history. If that's the structure of the interview, different professionals have different ways of doing this, but also in the history of present illness. So if you start hearing anything that sounds like a potentially spiritual theme, you can use part of the FACP tool at that point to bring that conversation up. But do you consider yourself spiritual? Or if people say, does that mean religion? If that's important to you, what is it for you? And then I is importance. How does it affect the way you care for yourself and your life and your health? C is community. So do you belong to a spiritual community? And many of my patients find their family to be, in one of our validation studies, family was the number one answer, which was interesting. And then the A part is, what are we, as we're hearing this, how do we assess that domain of spiritual health? It may be that people have really strong resources and it's helping them get through that and they should continue. Or it may be that they're grieving and they would like to talk to someone, and I would immediately start thinking about a chaplain as a referral. So for the first step is just ask the question. We have a little brief, even teaching video on the website on how to use the FACP tool. So they could do that. And I think doing a spiritual history actually helps with the therapeutic alliance that we have with our patients too, because it shows that we're interested in all of them and the whole person, not just the presenting complaint, which I hate that, but that why they're there, that we really are interested in that. So that would be the first step. And the second step is just ask it. I'll be happy if people just start with that and then start thinking, well, how do I integrate that? Yeah. And then the third step is we are currently doing in our second phase of an initiative called Advancing Spiritual Care, which is bringing clinicians of all types of clinicians with chaplains together to develop models of how this generalist specialist model works, to do more research now that we are building on how palliative care became a field. So we have demonstration projects in how clinicians working with chaplains can enact this in clinical practice. They're very successful, and that's going to begin to open up to more research in this area, which we really need to advance it to the point that it becomes really, truly becomes a required part of all of our healthcare.
Yeah. So you've mentioned this wonderful resource, and thank you for explaining a little bit about FICA, because some of our audience may not even be familiar with that. Are there any other one or two salient resources you might also nudge folks to take a look at?
Yeah, so Dr. Betty Farrell and I co-authored a book called Making Healthcare Whole, which went into quite a bit of depth on that consensus conference, and that some people find that to be helpful. And we certainly have, so the FICA tool is one. I think going to our website, we have a lot of resources in terms of YouTube presentations by us or other people that I think that are very brief and helpful. I really would encourage the clinicians, if they're interested in, we are going to be doing a sort of 101 course on spirituality and health. The ISPEC course is more of an advanced course, so we will hopefully be offering that by the end of the year. And so that will be a brief course that people can take to change their own practice, and it'll be offered over a couple of sessions, so they'll be able to interact and figure out a way to integrate that into their practice.
Wonderful. Thank you. Thank you for those suggestions. And I would love to ask how you apply this in your own life, whatever you're comfortable sharing. We'd like to hear a little bit of the personal side of the
Oh,
folks we talk
sure.
to.
Well, I think it's, I'm a human being as everyone else, and so I go through the ups and downs of life and the difficulties. But as I've mentioned, I'm really blessed that I had the kind of upbringing I had to understand spirituality in a very broad way and in an internalized way. That it's more than simply going to church, or temple or mosque, or it's really integral to to my development, and so that's been a critical part. As part of my spiritual practice, meditation is really important, as well as attending my faith community, which I find very important. Um, Animals to me are central, and during one of the many blessings of the pandemic was discovering a marina that is here in Virginia, and it is not the fancy marina. So it's really a nature preserve, and many living beings. The other day, there was a deer not too far from me, and we just stood there looking at each other for I don't know how long, and that was deeply spiritual to me, to be ensconced in nature, and which to me, the way I understand is that God is in everyone and everything is within God. So all of us, regardless of how we understand that, that transcendence or God, whatever word we use. So we're all connected. And to me, especially in times when we have societal unrest or things going around the world, for me, it's the daily reminder when I get up in the morning and at night when I do a meditation and prayer, is that we're all connected. This entire world is connected, and just to pray and hold each other in our thoughts, that to me is really central.
Very well put. Lovely. And it's all about connection across the board with others, as well as connecting to a higher power, connecting through nature. But connectedness is that key word, key element that's so vital to our health and well-being. So I love that. And as we close this relatively short podcast, my last question for you is, what is one main takeaway you would like for our listeners to close out this podcast with about this very important connection of spirituality with health and well-being? What's the single most important message?
I think for me, I think of spirituality as the roots of the tree. I actually think it is central. And I've had people from many different backgrounds, atheists, faiths, say something similar of this. This is really the thing that grounds healthcare. And if we look in our country and in other countries too, but I'm familiar more with the history here of healthcare. Who started healthcare? It was originally the Catholic sisters that came over, then other religious organizations, and it was service focused, love, compassion, and service. And all patients were created equal, and all patients are treated equally. And to provide that sense of refuge, that beautiful sense of refuge. I have a painting of the first hospice in France, and they converted a church into this hospice, and people would just come there and be cared for and loved until they died. And that's what I think we need to bring back. That's what this is all about.
Yeah, wonderful. Well, thank you so much for joining our GPHI podcast, Christina Puchalski, and thank you to our listeners. I hope to see you on another one of these GPHI podcasts. Please subscribe to our channel. We have so many other wonderful interviews to share with you. And in the meantime, be safe, be well. Until next time, take care, everybody.
Take care. Thank you so much.